Welcome to the Metabolic MD. Health means everything. We all seek optimal health, but most of us do not know how to achieve it. Dr. Paul Kolodzik has spent a career in the emergency department. Now, he helps his patients avoid ever ending up there. During these podcasts, you'll learn how you can lose weight and prevent and reverse disease through new technology, a modified diet, and the use of some new recently approved FDA medications. This information is not meant to be medical advice. Please seek consultation from your own medical provider. Let's listen in.
Well, Dr. Paul, welcome back for another fun-filled episode of the Metabolic MD with Dr. Paul Kolodzik.
Thanks, Terry.
How are you doing, by the way?
I'm doing really well. How are you doing?
Good. Did you have a great Easter?
I had a wonderful Easter. 13 hours in the emergency department. It was amazing.
That's true. You had to work the emergency room for Easter. We appreciate you doing that.
It was good. It was not a bad day.
All right.
And taking care of the vets, I enjoy doing it.
So Easter candy is not in your vocabulary, correct?
I do not eat a lot of Easter candy. That's correct.
No Peeps.
Terry, you're one of my peeps.
I hate to say that. All right. So, hey, let's get to the topic at hand. And what better topic for a 65-year-old guy to be talking about? Luckily, you're a doctor and you can handle this. What is the topic today?
Today, we're going to go ahead and talk about why women have weight gain during menopause, have difficulty losing that weight after menopause, why it happens, and what can be done about it.
Well, all right. So these are all questions that I've never thought of before because this is not my alley, and I'm just going to rely on you to kind of be the educator amongst us. So first off, what is perimenopause?
So that is the period surrounding menopause, commonly referred to as the change of life.
Yeah.
I'm doing air quotes now.
Air quotes. Yeah.
So the change of life. So it's a period of generally of 2 or 3 years where cycles are changing and eventually results in no more periods. But that's just one manifestation of what's going on physiologically in the body related to hormonal changes. Primarily the biggest one is drop in estrogen, but also drop in progesterone as well.
So if you had to describe to somebody like me who really has never thought about this much, what is menopause in general? What is it?
Well, it's when women stop ovulating, when they no longer produce eggs. Their ovaries no longer produce eggs.
So they can no longer bear children.
Can't bear children after that.
Okay, and that starts at what age usually?
It's variable. There are some women that can have early menopause. I mean, it can occur early in the 30s, but generally the period is somewhere from 43 or 44ish to the early 50s. And
what you're talking about today is the fact that when people approach this, they tend to put on weight?
Yeah, so let's talk about the physiology there. And of course, this gets back to one of my favorite topics of insulin resistance and blood sugar metabolism.
You do like that topic.
Yeah, I do. And we'll eventually work in the value of a continuous glucose monitor within this.
All right.
But basically, let's simplify this. Estrogen drops. And as estrogen drops, because again, the ovaries are no longer functioning in the way they did when the women were younger, then that increases insulin resistance. So that means blood sugar metabolism is not what it was when you were younger. Blood sugars have a tendency to rise because of this increase in insulin resistance issue. And of course, that causes weight gain.
So is this every woman has this? Because my wife is now, I won't say her age, but she's close to my age. She really hasn't gained any weight in this process.
Yeah,
so is it everybody, or is it just...
No, it's variable.
Okay.
Obviously, it can have to do with a lot of different things. Activity level, whether you have a predisposition to blood sugar problems in your family, etc. But let's go through the physiology of what happens with insulin resistance one more time, just so people understand.
All right.
Okay. So, and again, we're going to focus on carbohydrate intake because in taking carbs, not only sugar but complex carbs like starches and pastas, etc., raise blood sugar. So that blood sugar goes up when you eat. And then the pancreas, the organ in the middle of your abdomen, releases insulin. And that insulin is the key in the lock for that blood glucose to go into your organs like your muscles. We've talked about this in the past, to provide energy. So far, so good. But if those organs have plenty of blood sugar, have plenty of energy, they'll start resisting that signal from insulin. So the pancreas will keep kicking out insulin, but the organs will resist that signal. And then what happens is that extra blood sugar goes to the liver, gets converted to fat, and then deposited in the midsection primarily as visceral fat, the unhealthy type of fat. So that, because there's an increase in insulin resistance related to a drop in estrogen, that's why women in the perimenopausal and postmenopausal period often gain weight, or a significant reason they gain weight.
So their diet has not changed, but all of a sudden they just realize, oh my gosh, I'm gaining weight. Is that what happens?
Yeah, I mean your blood sugar is in general a little bit higher, so that extra fat is getting deposited, and then it's a challenge to reverse that process to decrease your insulin resistance, because the goal here is to reverse that process, lower blood sugar in the face of a little bit of insulin resistance, so you can burn fat instead of blood sugar as your source of energy, and that's when that weight loss can be pursued. So if it's in the middle of menopause, it's a consideration related to how to avoid gaining weight, and if it's after menopause, it's really the key, which is what we wanted to get to today. What is the best way to lose weight?
Well, my question that I could use some advice on, what are some of the signs of menopause? First, if somebody's sitting there like me and I don't know, what are some of the things that people would notice?
Well, I mean, a common one, of course, is physiologically periods stop or become, intermittent in nature, further apart. Okay. Weight gain, as we just discussed.
Yeah.
You've heard these hormonal changes causing hot flashes. So that's caused by what's called vasomotor instability, which just means your temperature control is different based on what's going on with your blood vessels.
Okay.
So those are some of the big ones. And then, there is at times a mood issue, even a depression issue associated with this change.
And how long does this menopause thing last?
Generally it's 3-4 years.
Oh, you go through this for 3 or 4 years?
Yeah, I mean, there are more, heightened periods during this, but yeah, it can last for 3 or 4 years.
And are there medications people would take for
yeah,
this?
So the treatment often is called HRT, hormone replacement therapy, where women take either pills or use patches to replace some of that estrogen, and that can be helpful as well.
And that reduces any discomfort that they're having?
Yeah, it can help mitigate those symptoms. I'll be honest with you, I'm not an expert in that area, but I know that hormone replacement therapy can be helpful for a number of women.
All right, so let's get to the point where what can be done if they've noticed weight. And by the way, how much weight people, if you had to guess, how much weight do people usually gain?
Well, it's variable, but it can be very, very significant. I mean, it can be 15 or 20 pounds, or it can be 60 pounds.
So, do you think this is driving some of the GLP use? People are reaching that and they're starting to gain weight and they say, I better get on a GLP-1.
Sure. So that is really the topic we wanted to get to today.
That's the topic?
Well, no, the topic of how do you prevent this weight gain?
Yes.
Or reverse this weight gain? Okay. So again, as we've talked about a number of times, let's hold off on the GLP-1 discussion.
I'm holding off.
Let's talk about the physiology here and what the best way to approach that is.
All right.
Okay, so we'll come back to, the 3 standard approaches that are very helpful in this regard. One is low carb, because if you're lowering your carbohydrate intake, generally 50 grams a day or less. Some people want to go keto, which is 20 grams or less, which I think is fine for variable periods of time. So that is, I think, the first and most effective approach. I think it's very hard to calorie restrict, focus on energy in, energy out during this period of time. The great thing about low carb is you can always eat something. You might not be able to eat something with carbohydrates in it, but if you focus on basically low carb, higher fat in your diet and higher protein, I think that's the approach. And, we always talk about this balance between if you're lowering your carbs, you're increasing your fat. But for most people, the increase in fat is not a problem. If you've got a high cholesterol level, maybe that's something to look at. We've talked about getting subfractions of your cholesterol done if you have a high cholesterol level. But for the majority of people, I firmly believe this. Blood glucose physiology is a bigger issue than cholesterol. So let's focus on that.
What about exercise?
Well, exercise, of course, is another component here, and this will integrate into the insulin resistance issue as well, because if you can increase your muscle mass, you can soak up more insulin and more blood glucose into your organs, and that will help reduce your insulin resistance. So again, this is why I'm such a big proponent of strength training, being adequate. And it's not that I don't believe in cardiovascular fitness. Yeah, you need to do the cardiovascular approach that meets the American Heart Association guidelines, which if you focus on it, you can do that in 75 minutes a week. But middle-aged women, for a variety of reasons, this insulin resistance reason and increased muscle mass helps reverse insulin resistance. It's important. Also, if you increase your muscle mass, you're decreasing your risk of osteoporosis. So exercise is a big component. So it's really, low carb, increasing muscle mass, and then, the third leg of the stool here is intermittent fasting. So, just if you can fast you don't have to fast for 36 hours. You don't even have to fast for 18 hours. Fast for 12, 14, 16 hours overnight, and that will help with this process. So if you're entering perimenopausal period or you're in a postmenopausal situation with some weight gain, think about this. Basically, low carb, intermittent fasting, strength training, and of course, because I wrote the book, Terry, we gotta using a continuous glucose monitor to sort out what's going on with your blood glucose physiology during this perimenopausal period, and then using a CGM to guide your low carb diet is a great approach. And since these are now available over the counter, really $50 for a 2-week CGM, very little to lose by trying a continuous glucose monitor to help guide this.
Tell you how great they are from understanding how food impacts your health.
Yeah.
I would highly recommend people even if they only want to try for 2 weeks, try it.
Yeah.
Now, I do want to get back to that thing we parked.
Yeah.
Right? That's the GLP-1.
Yeah.
My question for you is, if I notice I'm going through menopause, and I'm not, but if I'm going through menopause and I say, hey, doc, can you provide a GLP-1 to help me balance the weight gain that I'm seeing from menopause, would I not require GLP-1 after menopause is over because that weight gain has stopped? Because I'm out of menopause now?
Well, you're still in a postmenopausal period at risk for this insulin resistance issue.
Does it ever do I ever get through the gate and I'm through the gate and everything goes back to normal?
The answer is it gets easier, but it never, for many women, completely goes away.
Really?
Yeah. So it's always going to be a challenge because that estrogen's going to be lower and the risk of insulin resistance is going to be higher.
So wouldn't the right term be not postmenopause? It's just you're in menopause the rest of your life? You know what I mean?
No,
it's
menopause is the period of change.
It's a period.
Yeah. So that's why the term, premenopausal, perimenopausal, and postmenopausal are used.
Okay.
Okay.
So the GLP-1s, we talked a little bit briefly before, that could be what's driving some of the popularity of them because women are seeing a weight gain at this stage.
Yeah, I think, the majority of my practice is women for a variety of reasons. It's not just because they're the ones that gain weight. They seem to have better reality testing about being proactive related to their risks as their age.
Well, they care about how they look. Whereas if you get to my age and to me, it's like I'm still
but men also, it's they have risks and they we like to bury our head in the sand. I don't
true.
I'm not gonna worry about my blood sugars or my diabetes or my hypertension for years, and I'll just pretend like it doesn't exist.
Yeah, that sounds like me.
That's right. So getting back to the GLP-1s, first of all, you got to meet criteria for these medications used for weight loss.
Now, would that be covered by insurance? You think if I went as a female and to my doctor and says, I'm gaining weight, can you help me? He said, well, we can put you on GLP-1. Would insurance cover you, I think, or would that not?
This is something that we've talked about in the past, but the majority of insurances are not covering GLP-1s.
Yeah.
I mean, it'll come over a period of years, and
Right.
eventually they'll be available as generics. But it's just a cost issue. I mean, you think about it, and I'm not talking about just women, but 60% of Americans being overweight, at $1,000 or $1,200 a month. The insurance system can't handle that increased expense. Is it a good idea because you're warding off all this disease as people get older? Yeah, but the upfront investment is just too great. So, there are some employers, some insurance plans that will cover GLP-1s. We talked previously, I think, about Medicare does not cover a GLP-1 for
Right.
weight loss. Again, that's why I think anybody that's looking at this, prudent use of a GLP-1 while you're integrating these lifestyle changes is an important approach. So that's why I'm an advocate if you decide to reach for the GLP-1s. I've got to back up. First, the criteria is you got to have a body mass index over 27 with a metabolic health issue like hypertension or prediabetes.
Just for those folks that body indexing always confuses me. Let's say she's 5'8".
Yeah.
Just a rough idea what weight what might put her where she's over the.
Yeah, I mean, in that range, I'm doing this off the top of my head, but it's probably, for somebody that's 5'8", it would probably be like the 170-ish range or something like that.
Okay, so she physically looks like she's overweight.
Yeah, I'm doing this off the top of my head, but there's tables on it's easy to figure out, and it's not the best measure because, of course, you can have a lower fat percentage and a lot of muscle mass and have an elevated BMI because it's just a ratio of height to weight.
Yeah.
So it's not the same. It's not the be all and end all for everybody, but based on FDA studies, GLP-1 criteria. Indications for use is a BMI of 27 with an associated metabolic health issue or a BMI higher than 30 without any associated issue.
But if you have a BMI that's under that, there's no harm in getting on a GLP-1, right? It's just that insurance may not cover it.
No, it's not indicated. It's not. I mean, I think clinicians need to go by the criteria of what the medication is approved in. GLP-1 for weight loss. With a BMI of 27 or less without a metabolic health problem is not indicated. Terry, I have people come and, you got to think about this because this is a body image thing and what's helpful, but I've had people come to me with a BMI of 22 saying, I want to be on a GLP-1, So
and you say no can do.
Yeah, it's not appropriate. And part of this comes from my perspective of working 25 years in the emergency department, and just seeing people that are frail without adequate muscle mass, because these GLP-1s will decrease your muscle mass as well. Coming back to why strength training is so important. But yeah, I have had women come to me that body image can be a thing. I mean, it's why eating disorders exist with people really becoming emaciated because of the body image issue. And so, it's the medications are not indicated, should not be prescribed to somebody that doesn't meet those criteria that we mentioned.
Well, in Hollywood, I don't think they're following that rule.
Okay, well, in my practice, I do follow that rule.
Oh, good.
Yeah.
All right, so to wrap up our conversation here about menopause.
Just the GLP-1 thing again. I think you want to be looking at lower doses for limited periods of time. So if you've got this lifestyle program going on, which is what we do with all our patients, so it's sustainable long term. It is low carb, intermittent fasting, strength training, and then what I call microdosing of GLP-1s, which means lower doses for limited periods of time. So the plan is not to be on the medication
And that
for
way
the rest of your life.
it's easier to get off of it, right?
And
If
it's
you're lower
easier
dose.
to get off of it. And I believe the plan should be to get off it. There is the argument out there that obesity is a chronic disease and it needs to be treated for a lifetime. But I think fewer medications is better, and lifestyle changes are good. And so that's really what we do in my practice related to the guidance we provide and how I work with my health coaches.
So if somebody's going into menopause and they're visiting their general practitioner, are there questions they should ask? Let's wrap this up because we want to make sure. What's your guidance to them?
Yeah, I mean, the reason I have my practice now is because traditional medicine has not been real good at providing this kind of guidance. They can talk to their doctor about hormone replacement therapy. That might help. But if you're looking for lifestyle guidance with the components that we talked about and prudent use of GLP-1s, I think you need to talk to a metabolic health or weight loss specialist, like my practice. Because the docs are busy in their office, and in that 20-minute appointment once every 6 months, they don't have time to manage this as intricately. And that's why me seeing patients once a month, health coaches talking to patients once or twice a month, providing this guidance, making sure we're dosing we're all over the dosing of the medicine, not following the standard regimens where we just go up to a high level and keep you there forever. How can we keep the doses low and manage that as part of a comprehensive plan?
All right, well, let's leave it there. And we want to thank our sponsors, which you heard at the intro here. So, Dr. Paul, thank you for joining us again today. It's always fun to talk to you. I always learn a lot about today was menopause. I've never spent any time thinking about it.
Okay. That's probably maybe good then.
Maybe good. Well, thanks, folks, for joining us. We'll see y'all real soon.